Coughing is a common symptom in babies and can be caused by a variety of factors, including infections, allergies, and irritants. Some of the most common causes of coughing in babies include respiratory infections. Babies are more susceptible to respiratory infections such as the common cold, bronchitis, and pneumonia. These infections can cause inflammation and mucus production in the airways, leading to coughing. Allergies. Babies can develop allergies to things like dust mites, pets, and pollen. These allergies can cause symptoms such as coughing, sneezing, and runny nose. Environmental irritants. Babies can be sensitive to things like cigarette smoke, pollution, and strong odors. These irritants can cause coughing and other respiratory symptoms. Gastroesophageal reflux disease, GERD. This condition occurs when stomach acid flows back into the esophagus, causing irritation and coughing. Treatment for coughing in babies will depend on the underlying cause. Some common treatments include over-the-counter cough and cold medications. These medications can help to relieve symptoms such as coughing, congestion, and runny nose. However, it is important to consult a pediatrician before giving any medication to a baby. Humidifiers. A humidifier can help to add moisture to the air, which can help to relieve coughing and congestion. Elevating the head of the crib. This can help to prevent stomach acid from flowing back into the esophagus and causing coughing. Allergen avoidance. This can help to reduce symptoms of allergies and prevent coughing. Antibiotics. If a bacterial infection is the cause of the coughing, antibiotics may be prescribed by the pediatrician. It is important to seek medical attention if a baby's cough persists for more than a week, if the baby is having difficulty breathing, if the baby is producing phlegm, or if there are other signs of illness such as fever, vomiting, or diarrhea. It's also important to note that some babies may cough simply because they're learning to breathe or may have a mild case of laryngomalacia or tracheomalacia, which are common benign conditions that occur in newborns and infants. They involve softening or malformation of the cartilage in the larynx or trachea and can cause noisy breathing or coughing, but typically resolve on their own as the child grows. Babies have underdeveloped immune systems, making them more susceptible to respiratory infections such as the common cold, bronchitis, and pneumonia. They also have smaller airways, which can make it harder for them to clear mucus and other irritants, increasing their risk of infection. Additionally, babies spend a lot of time close to the ground and may be exposed to more germs and pollutants. These factors all contribute to the increased susceptibility of babies to respiratory infections. Symptoms of respiratory infections in babies can include coughing, sneezing, runny nose, fever, and difficulty breathing. It's important to seek medical attention if a baby's cough persists for more than a week or if there are other signs of illness such as difficulty breathing, fever, vomiting, or diarrhea. Treatment for respiratory infections in babies may include over-the-counter medications to relieve symptoms, humidifiers to add moisture to the air, and antibiotics if the infection is caused by bacteria. In some cases, oxygen therapy may be necessary if the baby is having difficulty breathing.